Hello, listeners. Welcome to Views on Health. A great pleasure to have with me after, I would say, a couple of months, Professor Indika Karunatillke, who's professor in medical education, Faculty of Medicine, University of Colombo, and also Professor Indika Karunatillke is the immediate past president of the Sri Lanka Medical Association, the premier medical body, which he headed in the year 2020. And he also wears another cap, that is vice president, or one of the vice presidents of the Organization of Professional Associations, better known as the OPA. Having said that by way of an introduction, a warm welcome to you, Professor, in the year 2021 to SLBC and the studios.
Thank you, and I wish you a very happy 2021 to you as well.
Thank you too. Thank you, Professor. And may I hand the microphone over to you to introduce the topic you want to discuss tonight.
Actually, I'd like to talk a little bit about COVID situation, the current situation, and what has to be done related to the control of the situation. This is more so because during 2020, I was involved with the Sri Lanka Medical Association and worked in very close collaboration with the Ministry of Health and other government authorities. So this is something that I would like to talk on because during that year there were a lot of experiences and a lot of kind of insight gained related to this situation. So this is something that I would like to talk about.
In fact, that will be timely, Professor, because COVID is rampant. And it's on everybody's mind, everybody's concerned. Life is going on, of course. It has to.
It has to.
And in the midst of all of that, we have to still take the necessary precautions. And then we do hear of the cases and then correspondingly deaths, all of that's happening in Sri Lanka as well as in the rest of the world. But concentrating on our country, in Sri Lanka, which we are concerned about right now, could you give us sort of an outline as to what is the situation and what we should do?
Okay, now compared to the last year, now this year, since early November, we have seen a surge of cases with many clusters coming up, and now the patient numbers are increasing. In the past, the patient numbers are very minimal. Say if you take before October, the numbers are minimal apart from the clusters that were sporadic. But now regularly, every day you are seeing maybe about 500, 600 cases. So obviously the patient numbers are on the increase. And now there were some clusters with very large number of patients were coming up. And another thing that we had to be concerned about is previously it was very much confined to the Western province. Now it has moved out of the Western province, and large numbers of patients are appearing and detected in Central province and Sabaragamuwa and the state areas. So this is a matter for concern, definitely.
So the spread is there. We don't know because the COVID-19 the virus rather is basically an unseen enemy. Can I put it that way?
Yes, correct.
Absolutely no visibility of how where is it, how is it going to affect you? Has it got onto you, or has it got onto somebody else who's close to you? Nobody knows anything till the symptoms come out.
Correct. And sometimes even there may not be symptoms even.
They're asymptomatic.
Asymptomatic, and you may be detected maybe during, say, random screening or testing. So that's also possible. So what you said is exactly correct. It's unseen enemy. And so therefore you really don't see the effects immediately unless you get into a serious situation. So, and that also may be playing on the mindset, because when you have to adhere to the preventive measures, it might have a negative impact because you are not seeing the enemy. We are asking to maybe wash hands, the hand hygiene, and we are in mask, physical distancing, all these things, but it's an unseen enemy. So that may be some worthwhile psychological factor to consider about.
As a matter of fact, Professor, when we say person is asymptomatic, and then obviously that person has a symptom but is not coming out, that's what it means.
Yes.
And then now that person, because he or she doesn't know that he or she is affected, because it's not showing, but you're in the midst of other people So that person can affect the others.
Definitely. I mean, even if you are asymptomatic infected, you can convey or transmit the disease to someone else. And what research has shown is the you can be infective even 2 or 3 days before the symptoms appear. So that danger is there. I think that's the biggest barriers to overcome if we are to control this situation.
So what would you advise?
I think basically return to what Sri Lanka has been doing correct during the first phase. That is adherence to the basic public health preventive measures. Say, if you are to control, there are a few things that you have to do. One is contact tracing, and if there are contact, then they have to be quarantined, because you have to separate those from the community for the very reason that you have discussed. Because even if you are asymptomatic, you can convey or transmit the disease, and even before you get the disease, I mean few days before you get the symptoms, you can still transmit. So because of that, if there are contacts, then you have to separate them, quarantine, and test and find out who are infected. And if someone is infected, again isolation. Again, the same principle. Isolation is very important, because most who get infected might not have symptoms, or it could be mild symptoms. Still, it is important to isolate, because we have to protect the community. Because once you are having the disease, you can transmit it. That's the very reason that we need to isolate who are infected. Even if they don't have symptoms, still it's a very important preventive measure. So that's a very basic thing. On the other hand, there are certain preventive measures that we can take, like maintaining physical distancing and wearing a mask, and the hand hygiene, and very important, avoiding crowded confined places with poor ventilation. Those very basics, they always are applicable.
Professor, if a person is in quarantine, even then should that person wear the mask?
Even then, yes, because quarantine means you are basically a contact, but you haven't got the disease. But it is possible that when you are within the quarantine camp also, you might get the disease from them. That is why the PCR is done in 2 weekly intervals. Even before you leave the quarantine camp, PCR is done, and only if negative, then you are allowed to leave, because even there's a risk of getting the infection. Because those who are in the quarantine camp, they are actually contacts, not infected.
What is the difference between the PCR and the antigen?
Okay, it's basically what it detects. Now, PCR is a kind of molecular method where you can detect the existence of the viral RNA through a sophisticated method, which is very complicated, which takes time, and very much cost intensive as well, but accurate, very accurate, because it detects the exact presence of the viral RNA. What the rapid antigen does is it detects the viral protein particles. Now, if you could remember the structure of the virus, there are spiky proteins, those molecules which the virus goes and attaches to the human cells. So what antigen does is detecting the protein particles, or what we call the antigen. So it detects the presence of the virus components in two different ways. But the RT-PCR is the gold standard, because it's the more specific diagnostic test, but you can use the rapid antigen test in the field, like a point of care test, and it is quicker. Within 15 minutes you can get the results. But RT-PCR, it might take several hours to get the results. So those are the differences. For diagnosis, you should be using RT-PCR. Rapid antigen testing, maybe you can use to find out whether there is infection going on at risk population. For example, if there is a fever going on in a factory, you can use a rapid antigen testing.
That is easy to detect.
Easier to
Affected.
detect. Only problem is, if it is positive, then it is very likely that this person is infected. But if it is negative, it doesn't say that the person is not infected, because rapid antigen test, that test has a kind of window which it can detect the disease. Once this window is over, then it might not be able to detect the protein particles.
So that is where the discussion comes in amongst the general public that the antigen test, rapid antigen test, is not that accurate, as you know, or people are a bit skeptical, I would say, to go with it. They prefer the PCR. They think the PCR is a better test to undergo.
Yeah.
As against the
PCR
antigen.
is a diagnostic test actually. The rapid antigen testing should only reserved for kind of public health response to find out where an outbreak is going on, infection is going on, whether someone is infective, you can find out that. But it may not be as accurate as the PCR. Other thing is this window period that it can detect very accurately only during the symptomatic period where the viral load is high. If the viral load is low, it might not be able to detect it.
That means the person can come negative, whereas the person could be positive.
Possible. Having symptoms and very suggestive of a history, contact history, and very suggestive symptoms, then having a negative antigen test doesn't mean that you don't have the disease.
So, Professor, again, a person who's testing positive after an antigen test will have to still undergo a PCR.
No, not necessary. Once positive, not needed.
There's no need to it.
No need. No.
But then, okay, in that case, but the person who's so positive and then under quarantine or observation or hospital, as the case may be, then at that point, at some point in time, after a period, the PCR will be done on the person.
It varies. Now the current policy in the hospital is if you are asymptomatic and if you are diagnosed as infected, after 14 days, if you don't have symptoms, you can be discharged without RT-PCR. Because the underlying principle is, again, a positive PCR doesn't always mean that you are infective. Because what research has shown is after about 1 week, following infection, then the viral load goes down and the person may not be infective any longer. But even during that time period, because RT-PCR is very sensitive, it may be able to detect the viral RNA particles. So positive PCR doesn't necessarily mean that you are infective. So because of that, nowadays, if you are asymptomatic, you can be discharged from the treatment center without PCR. It's a recent decision and it's a rational decision also. So a lot of complex decisions coming in. That's why it has to be based on science, very sound science.
Thank you, Professor. Now, if you a person who has had the virus and has recovered, can he or she get affected again? After some time, say a couple of months later, assuming we don't want this to go on, but assuming it is still there.
Still, we don't know. What happens is after an infection, after viral infection, a person gets immunity.
Yes.
So here also immunity happens. And there is worldwide research data appearing which says that the immunity for COVID-19 can last for a few months. So that's as good as information that we get at the moment. So at the moment we can assume that at least for few months a person will remain immune to the disease.
This thing, because basically some of the viral infections, once you get them and you recover, you don't get them again for
lifelong immunity. But these are influenza kind of illnesses. Usually, they don't give the lifelong illness immunity. So we don't know. But at the moment, based on the research data, we can say that it gives immunity, and which may be lasting few months, maybe at best.
I'm wondering whether this is a tricky question that I'm putting across to you, considering that Sri Lanka, we are having it tough, I would say, in the sense of hospital resources are really stretched, the staff is taxed to the maximum,
yes.
and we can do that much and no more. Then I don't think any government can go beyond a point.
Correct.
And we have gone beyond our limitations and done the best for the people. Having said that, Professor, would it come to a point where we would think that certain categories of those who are affected, I would say everybody, can be treated in their homes, advised to be home, do this, do this, do this, don't do this, don't do this, don't do that, and that is just to ease the situation, because I don't think it's fair to expect the health sector to take the entire burden.
Definitely, it's a huge burden. At the moment, as you may know, it's not only hospitals that are that the asymptomatics or infected are cared or being treated for. Now there are isolation treatment centers where very large areas of facilities are converted into treatment centers where those who are infected, they are monitored and then taken care of till they become, say, non-infective. So it's not an easy thing. At the moment, I think about 7,000 patients are under care. So it's a huge number compared to the hundreds that we have seen last year. It's a huge number. And every day about 500, 600 are coming up and all these are admitted. So definitely it's a huge challenge. But having said that, if you consider the public health response, why it is important to isolate those who are infected is to prevent the spread. So this is a very important strategy in preventing. The problem is in Sri Lanka, not everyone will be able to adhere to the same preventive strategies while at home. So maybe if you take certain populations or underprivileged population, it may be very difficult for them to adhere to those precautions. It will be very difficult. So in that way, the safer pathway would be adhering to this policy as long as possible. Other thing is, have we reached a situation where we cannot control the disease? Probably still not. So if we are still in a situation where we can control the disease, then the safest would be to follow the stringent possible measures, public health measures, so that at least we can have some hope of controlling. But if there's a point that we have given up hope of controlling and contact tracing, at that situation it doesn't make a difference. But not right now.
Unfortunately, Professor, I'm sorry to bring this up, but in Sri Lanka, we find that the people lack discipline, because even now we come across cases of media reporting that you find X number of people detected not wearing a mask, X number of people not maintaining social distancing, and such sort of, issues that which can be avoided. I mean, I'm saying it's like these people are adding to the burden.
Okay, I wouldn't blame the people only, because now some, in one way or the other, some kind of mindset is created.
And also even the hygiene of washing. At the start we say, wash your hands for 20 seconds, rather lather, and do all of that for 20 seconds before you wash.
Yeah.
But now that message is not very prominent, so people are just washing just a cursory wash and they're going off.
Exactly, because the thing is, those, as you initially very correctly said, we can't see this threat. So I mean, it always puts us off guard, because I mean, we are not really focusing about an unseen enemy. And on the other hand, those simple messages based on the science, like wash your hands and keep the physical distance, they are not very attractive. But something like a magic potion coming up and curing with you in no time, they are very attractive, because people like to live in a fantasy. That's the reality. So I think we should be able to give the message in a maybe more attractive way. Probably we have failed to give this message correctly. And worse than that, conflicting messages are doing. That's why I want to say this very clearly. We should not do anything that will divert the attention from the basic public health focus.
Thank you for that. Now, going on just from there, the treatment per se for COVID-19, Sri Lanka has been sort of cited as one of the countries initially that had its own methods of treatment that help people to recover fast. And those are very, very, I would say, very particular to Sri Lanka. Yeah. It's our native way of doing things. Would you recommend that? That it's the best way to go on?
You mean the initial method of the public health response, or
the treatment?
Treatment.
Yes, because there are sort of certain things like, be in the sun for X number of minutes, the vitamin C's and basic sort of things that are being administered in the hospitals, which actually worked initially, but
okay, I'm not sure whether the vitamin D and, I mean, it might have worked, might have worked. But what was more effective was basically the ventilation, distancing, and hygiene. Those were the things that have worked. I think it calls for a return to the basics of public health. There are, things like sunshine or the vitamin D. Those things are still unproven. There are some research evidence coming, but the main thrust is basically on the public health response.
Could you comment on the vaccine?
Yeah, it's it's good news. There is positive data findings coming out from at the moment there are 4 main vaccines, and they work in ways that basically it gets the immune system to develop antibodies in different ways. I don't think we have time to go into the technical details of the vaccines. It's a good thing. It's a good thing to have vaccines. And it's a good thing that it was developed within such a short time, because generally it would take about up to 10 years to develop a vaccine. But this time I think it's a success or victory of the science, that the scientists were able to develop this number of vaccines, successful vaccines within short time. Having said that, I don't think vaccine is the only solution. It's an important tool, very valuable tool, but you have to combine the vaccine with the basic public health preventive measures if we are to control this disease.
And those are the measures that you articulated a while ago.
Definitely. You cannot move away from that. They are the must. Vaccine is important, but without those, I don't think vaccine can. If the vaccine alone will not be successful anyway. Because even if you are to prevent the spread or the disease, then you need to reach at least 80% of coverage, which is very difficult. Even if we reach 100% coverage, still vaccine alone will not guarantee the complete control. You have to combine.
Thank you, Professor. Time has caught up with us. What's your take-home message?
Take-home message is, very simple. Stick to the basic public health preventive measures, comply with the health guidelines, and clearly understand the situation. And don't be misled by the myths and the misinformation.
Thank you very much. On that note of advice, we end this very interesting discussion on the COVID-19 situation in Sri Lanka as articulated by Professor Indika Karunatillke, who is a professor in medical education, Faculty of Medicine, University of Colombo, and Professor Karunatillke is the immediate past president of the Sri Lanka Medical Association and also one of the vice presidents of the Organization of Professional Associations. Thank you so much to Professor being with us on the program and telling our listeners about the situation in Sri Lanka. We truly appreciate it.
Thank you. Thank you for the opportunity. It was a pleasure.
Thank you. Thank you to Achila Gunasekara for technical assistance. I'm Fatima Razikari saying good night and hoping to be with you next Monday, same time on Views on Health.